to stand behind me, it's up to you. We know each other well. If you don't feel comfortable, that's totally fine too. All right. Great. So let's begin. I want to thank everyone that came out today. We have several. Steve, thank you so much. Bill, thank you so much. Pat, thank you so much. So thank you to supporters that are here. Thank you for showing up, and for those that have mobilized with us in this recent movement that we have for mass vaccination weekend. Thank you so much for coming as well. I also thank my wife and my daughter for being with me here today. And if Juliet runs around, that's just Juliet. So I just want to forewarn you in that. But today's announcement. We're here because I'm running for governor. What I'm hoping to share today is more about why I'm running, who I am, what experiences I've had in life that inform my values, and how those values will influence the way that I govern as compared to the way that others have governed historically in the state of Rhode Island. So for anyone that doesn't know me, my name is Munoz. I live in Pawtucket with my wife and daughter. Most of my family's in Pawtucket and Central Falls. My story in Rhode Island started in Central Falls. As a kid growing up, my mother and father separated as a result of my father having substance abuse issues. And so my mother, raising 5 children, had to find a way to both survive and somehow not lose sight of her kids. So as a result, we were really forced to find our own path. And myself and my 4 siblings did that. And that path wasn't easy. It wasn't easy growing up in Central Falls, going through a public school system that was under-resourced, and having very little in the way of mentors and pathways that could lead out of the square mile city. But when I was 17, something changed. Something clicked. I saw a community that was in many ways struggling as a result of inequities that were systemic. And I knew that I had to learn more. And the reason I'm sharing this is there are other inflection points in my development in my life here in the state of Rhode Island where those instances have happened again. And I think we all know that we've had them. As a community, we've had them. So going to Rhode Island College and studying philosophy and finding the words and the ideas and the concepts to know how to change these systems, while it was edifying, it just wasn't enough. Just like it's not enough that time and time again we have community members, community leaders that are on these steps asking for things to change, but nothing ever changes. We know our history, and we have leaders that don't acknowledge it. We see a path forward, and we have leaders that aren't bold enough to take the path. And so the first step towards taking that path for me was going to medical school. Finding the skill sets that I could utilize to address suffering that is in our communities, whether it be physical or mental. But going to medical school was an interesting thing because I then realized that there were very few people that looked like me. Very few people that understood the struggle and the lived experiences of the communities that they were serving. And the consequence of that is that lived experience and the values that manifest from it do not become a part of the working machine, which is the healthcare system, both in America today and here in the state of Rhode Island. And that is just one example that's replicated across all institutions. When I graduated from medical school, it was clear to me that the systems changes that needed to take place could not happen by practicing medicine every single day. It had to happen by engaging health policy, and by understanding the economics and the industry drivers that create either opportunity or barriers to opportunity. In 2018, I ran as an independent. I ran as an independent for governor of Rhode Island because I did not believe then that the Democratic Party in this state had the political courage to affect progress, real progress, tangible progress, free clinics, investments in low-income housing, expanding affordable housing across municipalities, and actually tackling an antiquated funding formula for our education system. But running as an independent was a barrier to itself. my lived experience had given me. It forced me to have to defend that I was of the people and for the people. And so while I do not regret running as an independent, because even today, running as a Democrat, I am challenging the establishment. What I was able to understand is that in order for us to move collectively, we need to stop saying that because the Democratic Party is not working for us, we're not going to engage politics. We need to come together and as a people move the system in a direction that is towards progress. Transform the Democratic Party in Rhode Island in a way that is both inclusive and reflective of the communities that it is serving. There is so much potential that we have as a state. There is so much beauty that manifests every day here in Rhode Island. But are we connecting the dots? Are we connecting the dots? Are we connecting the people? Robert Kennedy once said, progress is a nice word, but change is its motivator. And change has its enemies. We're here today because we know who those enemies of change are. And we're ready to mobilize, to confront them, and to fight for the policy issues, for the initiatives and the programs that will positively impact, that will help, that will support working families, historically disenfranchised communities here in the state of Rhode Island. And we've started the work, and we're going to keep going. And that's why I'm running for governor of Rhode Island, and that's why I'm running in the Democratic Party, and that's the progress that I'm running for. Thank you.
Doctor, last go around when you ran as an independent, you faced many obstacles from institutions, both inside the halls of government and also with media outlets that denied you the opportunity to debate, even though other independent candidates were allowed to debate. Is that one of the reasons why you're running as a Democrat this time?
Thank you for the question, Bill. And thank you for just acknowledging that that happened. I think too often there's a kind of a disregard, a dismissal of the lack of inclusion in the political system, and we see that across communities of color. At the municipal level, we see it at the state level. Is that the reason that I'm running in the Democratic Party? I'm not running in the Democratic Party to just get on a debate stage. I'm running because it is clear to me that the values in its purest form that the Democratic Party today embodies are not reflected in the leadership that we have. But there's an opportunity to take the candidates that are moving up at the municipal levels, pushing for progress, and to meet them halfway at the state level, to ensure that the programs they're fighting for locally are funded and supported at the state level. Happy to talk about specifics or address questions around that, but that's why I vote.
What other differences are there this year from last time that you ran? What do you see as being different about this campaign?
You know, last time I ran, just looking back and trying to learn from the experience, what was clear is that sometimes we move with our passion, and we bring that lived experience, and we believe that we are courageous, and in our own right we are, because we are stepping out. But somehow or other, there's a framework around which part of yourself you should show, which facet of your life is going to be enough to be acceptable. And I think in 2018, I somewhat struggled with that. And this time around, I'm starting today by acknowledging my lived experience, by acknowledging how that experience has informed my values. And it's because of the vulnerability that I've been able to accept, to acknowledge that others have come to stand with me. And this campaign is really about that, the community coming together and in solidarity standing for a type of leadership that doesn't just focus on the ends, but on the process to get there. So that they can influence the decisions that are made. So that we're not consolidating healthcare systems at the expense of access to healthcare, but instead investing in free clinics.
Dr. Munoz, just a few short weeks ago in this very building, you called for and then helped build a coalition to create really an unparalleled opportunity for members of what I would call the urban core to gain access to necessary vaccines this past week. How would you characterize the response of the two successive gubernatorial administrations towards providing health care for a challenged inner core in the state of Rhode Island?
Both administrations, and I would say historically all administrations in the state of Rhode Island, if we're talking about state leadership, have failed to move in a way that's reflective of having the lens of equity, as I said. We know historically that there have been health inequities. We've had enough data to know that women of color have more health outcomes than anyone else. This administration, like many others, has failed to understand the difference between equality and equity, between addressing the allocation of resources equally if you were sitting around a table and having dinner, as compared to acknowledging that there has been a systems issue that has disenfranchised patients of color, so much so that they are at risk for dying of COVID-19 at higher rates, at risk for hospitalizations at higher rates. And so do I think that this administration or the prior administration within the context of COVID-19 have responded appropriately? The answer is no. And the reason they haven't is they mounted field hospitals that cost over $1 million before they were implementing pilot tests for COVID-19 testing in South Providence. So if there's an indicator as to why 2020 or how we could discern in 2020 that there wasn't a movement towards equity, that's an example. If there's an indicator why there wasn't a movement towards equity in the new administration, is that in the sequence of events for allocating thousands of vaccines to a population, in the sequence of events, because I want everyone to live, I want everyone to have that shot, but in the sequence of events, disenfranchised communities, higher risk communities like Blacks and Latinos, Asians, and indigenous populations were not first and at the forefront of thousands of vaccines being allocated directly for them. They were second. And we're done being second.
Did these institutional failures, even in the years leading up to COVID, set the stage really for human tragedy here in Rhode Island?
There's going to be a consequence. There's going to be a level of generational trauma that's going to result not only from the losses that we've had in life, the harm that's been done for those that have survived but been impacted by the disease, but by the economic consequences of this crisis, which if we don't start talking about the war against poverty in the state of Rhode Island, how will we prepare for 6 years from now when families that are struggling today will struggle even more so then?
Last question, if you don't mind, I appreciate the opportunity. A great deal of the business aid that's been generated by the federal government in the form of SBA loans, PPP, all of that has really been geared towards medium to larger sized businesses. Now, of course, you've got the advent of this stimulus bomb that's about to land in the state. Have the resources been adequate for what I would call small to micro businesses, particularly in the south side of Providence, the west end of Providence, Central Falls, the inner core? And what do you call for in terms of representation for that as a result of the stimulus?
Yeah, there's representation for micro businesses, and we can use an example of the Hispanic Chamber of Commerce. What we've learned in this crisis is we have had micro businesses, right? The businesses that build up our local economies that were unable to access PPP loans because they did not have basic QuickBooks software implemented in their businesses. And so why is Commerce Rhode Island focused on tax incentives for medium to large size companies or small businesses that are making revenues of $5 million plus a year, instead of focusing on micro businesses where if they would invest at least in the software that those businesses could utilize to access other resources, it would have made all the difference in this crisis. And so moving forward, we need to redirect Commerce Rhode Island towards micro businesses. We need to also take progressive steps towards not only supporting those businesses and helping them scale and grow, but hopefully by doing so, tying it to retraining programs and economic opportunities so that single mothers that are in the Rhode Island Promise program, retraining but still working at a local restaurant, can have a livable wage and survive in a state where the cost of living is becoming too significant.
To that point, today there's chatter on some of our local airwaves that people are lazy for not going back to work in service industry jobs and continuing to stay on unemployment. How would you remedy this situation with folks who are making poverty wages if they go back to work and rationalizing going back to work when they're making more on unemployment? In other words, how do we get out of this spiral here that's pitting small business against essential workers?
The governor, not just for the next 2 years, but for the next 6 to 8 years, is going to have to make decisions as to where to make investments, how to create systems in you. And in terms of our local economy, how we approach that local economy, I think I want to answer this in a short-term solution and in a long-term. So the short-term solution, I think here is acknowledge that the risk is disproportionate, to the return on investment, right? For people who are weighing going back to work, when again, even this week we've shown that they did not have access. Many of them did not have access to a vaccine. We have workers that don't have access to hazard pay still in this state. It doesn't make sense. So do I fault individuals that want to live for their families and are willing to suffer the burden of name calling to keep their lives? No, I don't fault them. But moving forward, I think what we should be doing is we should be addressing hazard pay for essential workers. We should be actually making investments again in our local economies that promote, through programmatic change, promote small businesses not only increasing or heading towards a path of scalability so that they can grow and be more than a lifestyle company, but also tying that to the retraining programs that we have. Why do we have Rhode Island Promise, which is a great program, but still shuts out adults that have jobs and can't attend full-time? It shuts out non-traditional students, right? So how do we connect the dots? How do we connect retraining to Rhode Island Promise to a level of stimulus in our local economies that can supplement wages to ensure that we have livable wages for people who are already on a trajectory of doing better in life because we're going to help them?
Thank you, Doctor.
Thank you so much. Thank you, everyone.
Thank you.
Thank you.